Hello everyone, I'm Dr. Mounica, working as consultant reproductive medicine at Ferty9 Hospital, LB Nagar, Hyderabad. Today we're going to discuss topic uterine fibroids. So in uterus we have three layers. The innermost layer, it's the uterine lining, which is called the endometrium. Then the intervening middle layer is mainly comprising of the musculature, that's called the myometrium, and the outermost layer is called the uterine serosa. Now these fibroids are nothing but there are certain amount of swellings or overgrowth of the uterine musculature in certain areas that end up forming lumps or swellings, which are referred to as uterine fibroids. These fibroids can be diagnosed on a simple transvaginal or even a transabdominal scan, and the location of the fibroid also can be made out. There are three types of fibroids classified based on their location. First, it is submucosal fibroids. Second, intramural fibroids. Lastly, being the subserosal fibroids. The first and foremost, which are submucosal fibroids, they are very important or very relevant in reference to our infertility issues. Now, this is because if the fibroid is a submucosal fibroid, this is majorly going to push or cause some indentation pressure effects on your uterus inner lining or the endometrium, wherein the embryo has to come and implant itself. Now, because of the presence of a submucosal fibroid, there can be certain amount of distortion of your uterine cavity, causing you difficulty in conceiving naturally or even through treatments. So if you have a submucosal fibroid, what is the size of the fibroid, how much it is distorting your cavity can be seen on a three-dimensional scan, and accordingly you need to go through some form of treatment to remove it. Second, we have the intramural fibroids. Now these intramural fibroids are totally confined to the middle layer, that is in the uterine musculature. They are not greatly coming and pushing the cavity. Now last being the subserosal fibroids. Now these subserosal fibroids are mostly towards the external aspect of the uterus. Now among these three fibroids, mostly we are concerned about the submucosal fibroids, the first one, which are distorting the cavity. Now the other fibroid, that is intramural, it is okay as long as they are small in size, but if the size of an intramural fibroid is more than 3 centimeters, or it is causing some difficulties or some disturbances in your daily life in the form of heavy bleeding during menstrual cycles or having immense pain during your cycles in the form of dysmenorrhea, then also it is advisable to undergo a surgery to get rid of the fibroid. The next question they ask is, can the fibroids be treated medically? Now, fibroids can be treated either medically or surgically, but in terms of medical treatment, there are certain oral medications or even injections for that matter, but they are not a permanent cure for fibroids. It has to be a proper surgery, which can be open through a laparotomy, or it can be a laparoscopy guided surgery wherein we remove the fibroid, and the process of a removal of a fibroid is called myomectomy. In some instances, even hysteroscopy guided myomectomy is done. That is, a camera is introduced through the uterine natural orifice via the cervix into the uterus, and via the hysteroscopy guidance, some part of a submucosal fibroid can still be removed. The fibroids in relation to infertility. Every lady who has a fibroid does not mean that she is going to have trouble conceiving naturally, because sometimes after conceiving naturally in the scans also you end up finding fibroids. So fibroids are not the sole reason for infertility, but they can cause some trouble. They can add on to our problems. So figure out what is the kind of fibroid that you have. Is it going to create troubles in conceiving, and accordingly the clinician will guide you. Thank you.